I think the biggest thing is that they're changing our expectations for survival. And that's such a wonderful thing to be able to share with patients and families. Oftentimes the old adage, the old wisdom was that if you were diagnosed with stage 4 cancer, the common refrain, the first thing that you hear is, you've got 6 months to get your affairs in order. And I just had this conversation with a family prior to coming here about that, and it was a patient who was newly diagnosed stage 4 melanoma, and the physician that was treating him said essentially the same thing: you have 6 months to get your affairs in order, without that patient or the family having an opportunity to talk to an oncologist. So it's a devastating thing when that's not an informed prognostication. So it's really incredible to be able to share with them that we now have 5-year survival data in melanoma and are seeing that over a third of those patients are still alive. And in lung cancer now are seeing that a quarter of those patients are still alive at 3 years. So in one way that has completely changed things, it's changed the conversation. And we can now set better expectations for patients and families, provided that they respond. So I think that that's one way it's really changed the field. And to be able to see people that are alive and doing well years after their stage 4 diagnosis is an amazing thing to see, and an amazing thing to be able to share with people. We're giving them hope, and that's what people rely on the most. I think another way that it's changing things is also how we take care of those patients now that they're in remission. So you have your longtime survivors, and how do we take care of them? This is a whole new problem that we're having to deal with. It's a good problem, but a new problem that we're having to deal with in oncology, because we have these lung cancer patients and these melanoma patients who are years out from diagnosis and may not have any active disease, but they may be having still active side effects from their immune therapy. And something I've been working a lot with at my own institution is to create this concept of immunotherapy survivorship. Thinking about stage 4 patients as survivors now, which we really ought to do. And how do we treat them differently from the early stage survivors, and what are their needs, and how do we shore up resources around them? And it's a great problem to have.